In terms of COVID and how it's impacted people coming in when there's concern for strokes, it's raised some interesting thoughts and also concerns about very genuine and legitimate concerns in the public about when is appropriate for them to come to the hospital in the context of this broader public health crisis, and getting other urgent medical needs taken care of. I think we've seen and um, less currently reported, but that certainly been shared to us by our patients, whether in the clinic or in the hospital after the fact, is that they'll have concerning symptoms at home, and yet they may delay coming to the hospital because they're worried about getting exposed to COVID, or they might be following just general, social distancing recommendations to try to avoid interacting publicly or socially. The treatments for stroke are all very, very time sensitive. And so the normal practice or recommendation, if we were to ignore, if COVID were not to happen, we would tell people, if there's any concern at all, call 911 immediately and come to medical attention as soon as possible. Because, we always say in stroke, time is brain. The sooner you come into the hospital, the better our treatments are going to be able to work. So it certainly has presented some challenges. Stroke can range in any number of symptoms. Oftentimes, folks may present with a facial droop on one side of the face. They may present with weakness in one side of the body. Others may present with language changes. Specifically, they may find themselves not being able to talk. They may be able to think of the words, but just can't get the words out. Slurred speech. And it can present in a combination of those symptoms as well. And so generally, when we advise our patients in the clinic and in the hospital, if our patients notice a new symptom that comes on quickly, call 911, come to the hospital as soon as possible. Strokes, technically can happen in any age population, but we certainly see it with more advanced age. So I think as everybody gets older, the risk for stroke increases. And certainly there are other medical conditions, risk factors, is what we would call them, that increases the risk of stroke. Namely things like having high blood pressure, high cholesterol, diabetes, smoking history, atrial fibrillation. Those are some of the common causes of stroke, risk factors for stroke. Things that are typically associated with our older patient population, but younger patients are not necessarily excluded. There are certain conditions that can happen where even very young people can have strokes. Being a comprehensive stroke center at Harborview, we take a lot of pride in this, and we have multiple departments working with us, as well as multiple dedicated staff, really making sure that we as a comprehensive stroke center are really at our A game. So what that means is that we have all of the available resources 24/7, whether that's imaging, the staff, including stroke neurologists, neurointerventionalists to perform these procedures, all of the resources and treatments available, such that if a patient comes in, we can provide all of that at one place. Harborview, I think, in Seattle has really led that effort, and so we really, take pride in being able to provide this level of care for our stroke patients. In terms of reassuring the general public about, coming to Harborview, for example, to get symptoms evaluated and treated in the setting of this very concerning, COVID-19 public health crisis, this has been a challenge for everybody, for the public, for us as a hospital, for our staff, our doctors, our residents, and our trainees. Particularly difficult early on. We pride ourselves as a comprehensive stroke center. We have our treatment algorithms and protocols, really refined to a T, and we genuinely take a lot of pride in it. COVID really was a shock to our system initially, as with any hospital system in the country. But we've really spent a lot of time, as this public health crisis has evolved, to refining our protocols to make sure first and foremost we protect our patients, but also the staff that are coming to evaluate and take care of the patients. Most of our staff are vaccinated at this point, and so I think there's an extra confidence for a lot of us that we are being, with the vaccine, we're in a position to do what we all signed up to do, which is to provide the best care for patients that we can.